Welcome to Third Floor Views, a production of Chesapeake Family Life, where we talk about health, education, and living with kids. I'm your host, Janet Jefferson. Today, we are talking about the anticipated COVID vaccine for 5 to 11-year-olds and other important vaccinations that you should be thinking about for your children. Joining us is Dr. Catherine Edwards, Medical Director, and Dr. Margaret Turner of Annapolis Pediatrics. Thank you to both of you so much for being here today.
Thanks for having us.
To our viewers, oh, definitely. For everyone. And I think for parents, this has been on our mind for a really long time. And now we're at another big moment, a big turning point. So I think we're excited to move forward. To our viewers, if you do have any questions or comments, just feel free to put those in the comment section and we'll get to as many of those as we can. Well, let's get started. Let's just jump right in. We're waiting, literally expecting possibly any minute to hear from the CDC in terms of approval for the COVID vaccine for 5 to 11-year-olds. I first would like to just talk a little bit about the vaccine itself. How is this vaccine maybe different from the adult version, or is it exactly the same?
I'll take this one a little bit. It is the Pfizer vaccine that we're talking about. And it is the big difference is that it is a different dose. The adult vaccine is a 30 microgram. I mean, it's kind of a random number. It doesn't mean much to us, but it's 30 micrograms of the vaccine per dose. And the vaccine that was tested in kids is 10 micrograms. So it's 1/3 of the amount of dose. Now, there's a lot of different reasons for this. Kids are smaller, yes, but they also have more robust immune systems. So it doesn't take as much for them to develop immunity. So that's kind of the big difference. Now, I wanted to just real quick, I think people also get confused about well, why does this take so long? For this, we've been talking about it. And I'm looking over here because I always make notes about the numbers. And the reason it took a while is a couple of reasons. First of all, the FDA went back. The original study sample size was about 2,500 kids, and the FDA asked them to increase that. So they recruited more children. So there was more children in the study. COVID is less common in kids, right? I mean, we all hear it's getting more common, but it's still less common in kids. And so there's lots of statistical modelings to get a statistical significance. You have to have a certain number of cases in both the placebo arm and the non-placebo arm. And so, COVID was decreasing in incidence anyway. So it just kind of took longer. And then you've got the process of, I know we're waiting for the CDC today, but first, and I looked all this up myself. First, this committee of experts advises the FDA, and then the FDA makes its decision, but then the same thing happens with the CDC. And then there's an independent advisory committee, and then they make their decision. And then once both those things has happened, then it's sort of approved for the emergency use authorization. So as you may have heard, Pfizer released the data a while ago, but then it had to go through this process of a couple of weeks before it could actually get out there. So, so that's kind of why it's just, and that's great, right? It's been studied and approved. And just also numbers wise, the 2-dose, this series had a 91% efficacy rate in the study population. And, again, Margaret always says, don't quote too many numbers, but that's similar to what it had in adults. But then, as we all saw, once it's given more widespread use, like it's not a 95% effective vaccine in everybody. There are breakthrough cases. So we're not expecting that, but we just need this whole segment of the population, to produce herd immunity will now be vaccinated to enter into that. So, it'll likely work just as well as in adults.
Right. Yeah. Because that's 5 to 11-year-olds. That's a pretty big group of the population. And then it sounds like, Dr. Edwards, from what you were saying, it should make us feel really good that there is this process that we're moving through. So we should all, as sort of the public, should feel really good about it being super safe. And it sounds like also really effective. 91% that's a really good, or that's a really high efficacy rate. Is that right?
Yes. vaccines are never 100%. And I think sometimes we hold unrealistic expectations for what vaccines can do. So I think, people, even with the breakthrough cases we've seen in the adult population, people are like, see, these vaccines don't really work. And you're like, the vaccines are working amazingly well. And even with the waning immunity that we're seeing, and now with having to booster, I think it's been really hard for people to watch science happen in real time. Science is messy and science isn't perfect. And so 91% is absurdly good. A normal flu vaccine is 63% effective every year. And yet most people get a flu vaccine every year and think that's pretty darn good to get a 63% effective vaccine. To have a COVID vaccine that is 91% effective is phenomenal. So I think we sometimes forget that we're not asking for perfection. We're asking for really, really good. And what we want is the more people who are vaccinated, that 91% becomes even better. Because then there's less risk for breakthrough. That herd immunity concept is a really important one when you're looking at vaccines. And I think we have to keep remembering there's individual benefits and then there's population health benefits. And so all through every vaccine discussion, you have to look at both individual and population health.
And I think other points about safety is over 415 million doses of the vaccine have been administered in that's I think in the United States alone.
Yeah.
And
that's a lot.
So that's a lot. And kids are benefiting. You can, in my mind, you can take some safe, some reassurance in the fact that that many doses have been given. If you think about when other vaccines are given and we always hear about, the more doses are given, more side effects come up. For a lot of the vaccines that we give to kids now, to reach 415 million doses of any vaccine given within a year, I think that's probably, it took 10 years to give that many doses of, most other vaccines that we give. And so, yes, people do talk about, but so statistically, if there were side effects that were overwhelming and would make us halt the vaccine, there is no question we would have seen them by now. That with that number of doses given, the statistical significance and that it's almost unheard of for vaccines. So it's almost even safer. You almost have more reassurance. It's almost like you have 10 years of data instead of just one on any other vaccine.
That's a great way to frame it. I think that sometimes people have a hard time putting things into perspective. So thinking about, oh my gosh, we have seen so many of these vaccines administered that we know, okay, yes, it's like looking at a time period that's been completely compressed. And so if we were going to have problems, we would definitely see it. And that we're really not seeing problems. So that's really exciting. Another question I have is, how is vaccine testing for children different from adults? Or is it really similar? In terms of how they're going about the actual trial, is it similar how they did the adults, or is it different?
I mean, as far as I know, it's pretty similar. The basis of a vaccine trial is, you do have studies that show the basic safety, and, we basically had that in adults. So I don't actually know why they chose 10 micrograms, but they chose a lower dose. And you basically have two populations, and you give two populations of vaccine, and they're blinded. So they don't know who's getting the vaccine and the sugar vaccine or placebo pill, whatever you want to say it. And then you follow those groups, and you see how many people in the end in the vaccinated group and in the unvaccinated group who went about their normal lives got COVID, basically. So it's pretty similar in the sort of theory and thought process of it. And they also follow titers, meaning they draw blood to, see what the antibody levels are, in the various people. So it's pretty similar in the sort of basic science and statistical analysis of it.
That makes sense.
Measure closely. We used to do vaccine trial work in our office. And so my kids were on both the bird flu and the swine flu trials when we had you know, when we were doing those vaccine trials. And in fact, my younger son had huge reactions to flu vaccine when he was a kid. He used to get these big red swollen arms all the time. And so when he got the one, you know, blinded vaccine, his arm blew up and got all red. And I was like, oh, he didn't get placebo, he got the flu vaccine. And they almost disqualified him from the study because he had such a big reaction. So they monitor the reaction to the point of like, you have to measure how big and red and swollen an arm gets, and you have to take their temperature every day for a week. And so, you know, when you're a participant in one of these trials, you're monitoring every little vital sign and every little tiny thing. You're watching for side effects. So they monitor kids very, very closely the entire way through the study period, while they're getting their blood drawn a couple of times, 3 or 4 times through the process. So it's a very, very closely monitored time period. And so they really are looking for anything untoward while the kids are on the trial. And then they compare the placebo group to the vaccinated group once they're unblinded, and they look to see, are all the kids with a big red swollen arm getting the vaccine and the ones without got placebo? Or, you know, is that from the shot, or is it from the vaccine?
Right.
And that's how you do the science. So
there's some preliminary data, I think, that actually kids in the study had a decreased incidence of just the local side effects that a lot of adults had of achiness and, you know, flu-like symptoms. That there's some, I think that was compared to the number in the adult studies was what that was.
Is that related, do you think, to, you said that kids typically have a more sort of a stronger immune system, a more reactive immune system? Do you think that explains that in terms of less reaction?
I don't know particularly. Again, they got a smaller dose and they probably are able to handle things. So, but also again, when you have a small study size, you know, I don't think in the initial, when they released the initial vaccine, there was that much. And then people started getting the vaccine and they're like, oh my God, I feel sick, you know? So, so it remains to be seen. I think the message that we need to be giving is that the risks of COVID are higher than the risks of a vaccine. You know, if we really want to, you know, speak to people and their concerns, like that's kind of the bottom line. There are lots of specifics in there, but, you know, and, you know, some people say, well, you know, kids don't get as sick and everything, but there have been, and I'm looking at the number here, there have been like 600 deaths in kids from COVID. You know, 23,000 kids are hospitalized with it. 600 children ages 18 and under have died from the disease. 6 million children infected. Like, these are not small numbers, you know? So, you know,
I read a statistic the other day that said that COVID is actually the 8th leading cause of death in kids right now. And when you hear that,
so
and
healthy,
you think,
so anything,
you know, 8th leading cause of death, I can't imagine why we wouldn't vaccinate every eligible child for the 8th leading cause of death.
Right.
So you're a parent to prevent your child, to keep your child safe. And there is something out there that is making your child not safe. And in fact, you know, we tell kids to wear seatbelts and like not play around pools, and like more kids are dying. You know, it's just, we do a lot to protect our kids against things that are actually less deadly than COVID. So I think we really need to, you know, think about that. And it concerns us because there's been some recent studies that say that, you know, only 1/3 to 1/2 of parents will get their kids vaccinated right away. And so that, you know, so we want to, you know, we don't just want to, pediatricians always never, you know, we don't just want to say like, go get your vaccine. Like, we really want to try to meet people where they are. Like, we spend a lot of time at visits, not just about the COVID vaccine, but every vaccine, you know, really trying to understand like, okay, what are your hesitations? Like and that's why we're doing this, right? Like, you know, and so, yeah, you should feed us questions that you think parents will ask, you know, what are your concerns? How can we address that? It's like, we're really in the, you know, changing minds, like one at a time, I think is, I mean, that's kind of that's what we're down to. That's what we need to focus on.
It is helpful, hugely helpful, I think, to have both of you being our local trusted pediatricians putting things in perspective. Because when we hear the CDC saying, oh, the benefits outweigh the risks, it's like, okay, got it. But thinking like, what are those benefits and what are those risks that we're actually looking at, and thinking how you were saying, oh, 600 kids are actually, have died from this. And Dr. Turner, you said it's the 8th leading cause of death in kids. That is helpful to put things in perspective in a way that maybe is a little bit more tangible. What are you hearing in terms of parents who are coming in with concerns? What are sort of the common concerns that are reaching you in the office? And Dr. Turner, I'll start with you.
So actually, we had done a Mythbusters video not too long ago, really addressing some of the biggest things that we do here. And the hardest ones to hear are actually the ones that are the blatant misinformation. And so that, the fact that people think that the vaccine causes infertility is heartbreaking. Like, this is false. This is not real. This is not science. And so when a 12-year-old girl comes in and says, or a parent comes in and says, I'm not getting it because we think it will cause infertility, this is not real. This is 100% not real. The idea that somehow the vaccine is going to alter anything about your inherent fertility issues is wrong. That is probably the biggest one that just makes me sad. We hear all the time that it just hasn't been out long enough. And so, what Dr. Edwards mentioned about, I want to wait till it's been out a longer time, or it's been out for longer. All vaccine side effects happen within the first 2 months of vaccine administration. So we have seen 10 years worth of data in the year that it's been out. So any side effect that has happened. And I think, unfortunately, sensationalized news media makes things like blood clots and myocarditis and things like that seem much more common than they are. So things like the blood clot risk with the J&J vaccine is infinitesimally small, whereas the blood clot risk with COVID is quite high. The cardiac damage that is done by COVID is astronomically high, whereas the myocarditis risk with vaccine is infinitesimally small. And so I think we look at things in a very three-dimensional way and look at risk in these, risk benefit ways that I think parents hear something that sounds very scary and then shut off all thought of like, oh no, if there's even a tiny remote possibility, I don't want to even take a chance, forgetting that the risk of disease is actually much, much greater. And quite frankly, I heard Paul Offit speak recently, and he's sort of the father of all pediatric vaccine talks. And he said, you have two choices right now. You either get vaccinated, you get the disease. There is no other option. And I think that is often what we are seeing. So you're going to take your chance with the disease, or you can roll your dice with the vaccine that is proven to be very, very safe.
Yeah, so, maybe this is a good time. I mean, I think it is important to address people's concerns head on, like about, myocarditis. And so, and some of those risks that people have heard about. So, again, we just talked about over 415 million doses of vaccine have been given. And there's been kind of just under 2,000 cases of this myocarditis that have occurred, that has mostly been in males under age 30. But so I think if 2,000 out of 415 million is a pretty infinitesimal number. So rare is an effective, I think is the accurate word to use for that. And other things about that. And just for people's information, myocarditis is an inflammation of heart muscle, which can occur from lots of different causes, including actual COVID infection. And so, I think you have to think of it in terms of a rare reaction, and it's a self-limited, people have gotten better. It's not as bad as the MIS-C that people get from COVID. But I think if you sort of delve into the psychology, and I don't know if this helped people or not, but the difference is like, if you're making a choice to get the vaccine, and getting COVID seems random. So in our psychology, like that's why people won't get the vaccine, because because they're actively doing something. Whereas like, they sort of feel like, well, I can prevent COVID. I can wear a mask. I can, stay inside. And, even though it's a random act. So it's like this like random act versus something that you've made a choice and done. And if that happens, so I think that's what's hard to overcome about like some of these side effects, even though they're rare, it's a choice you're making. So I think we really have to just, the statistics help me. Margaret says I talk too much about statistics, but I live my life. I'm reassured by the fact that it is rare. And so I'm willing to, I think that it's important. And also there's clear data that the risk of myocarditis after COVID is higher. There's far more than 2,000 cases of myocarditis and other very serious heart issues after getting COVID. And just like Paul Offit said, like we're all going to get it at some point in time, likely. So, unless you have the vaccine, but even if you have the vaccine, you'll get it. But so, but then when you get the vaccine, the data in adults, and I'm sure this will carry through in kids, is that, the people who are hospitalized now and who are dying from COVID are mostly unvaccinated. So there are breakthrough infections. No vaccine is perfect. It's just like every other vaccine, but your risk of hospitalization and death is so much lower with the vaccine.
I think that's really helpful. And to hear from both of you, just that, yes, there are these risks, but to compare the risks of the vaccine right next to the risks of COVID, it's not even a fair comparison, because any risk from the vaccine, as you were saying, it's almost infinitesimally small. And then COVID, it's a real risk. And so not only is it like the numbers are on your side for the vaccine, you're just less likely to get sick or have any side effects, but then also the severity of it. So Dr. Edwards, you were saying, people have died, people are in the hospital, you have these really severe problems associated with COVID, but with the vaccine, if, and we've already established like if, and it's very, 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 very unlikely that it would happen. If you do have a problem, it's probably not going to be that big of a deal. So I think that's helpful to think that it's really not even a fair comparison in terms of risk. It's so clear that the risk of the vaccine is very low, and then the risk of COVID is very high. So that should be helpful. And I think the other thing, hearing from both of you is just how important this is, for everybody, that it's not, yes, you're protecting the individual, but then you're also protecting the group. And your quote, Dr. Turner of you said Offit would say that, one way or another, we're going to get it. And so we could choose to get it and make sure it's this option with a much lower risk, or we could sort of roll the dice and hope for the best, but then really in terms of statistically speaking, we're going to get it. So it gives us a lot more control in a much safer environment. And the numbers show that really things are fine if you get the vaccine, not only fine, but great. Whereas if you get COVID, things could be very, very, very bad.
So, and I do
another thing. Okay.
Focus on, we're sort of, I hate to feel like we're catastrophizing a little bit with COVID in kids, because most kids with COVID are going to be just fine, and they're going to do fine, right? So for the vast majority of kids, they are very, very, very unlikely to be sick, very sick. So, but just like with flu, people often choose not to get a flu shot because they say, well, it's just flu, it's not that big of a deal. The problem is that you never know who is going to have a catastrophic illness with it and who is just going to have a cold.
Right.
And so because we can't predict and we can never know which kids are at risk of having severe disease, you have to vaccinate everyone. Just like the day you go out in the car and you decide not to wear your seatbelt might be the day you get in a car accident. You have to always be protected.
Right.
So you could never forgive yourself if your kid was the one that died from flu. You could never forgive yourself if your kid was the one that died from COVID. Even though 99.9% of kids aren't going to die from COVID, I don't know how you look at yourself in the mirror if you had a vaccine that could have saved them and you chose not to do that. And so that is our job as pediatricians, is to give people the information and then let parents make the decision that feels right to them. But we want them to know what lies on the other side of that decision, because we've seen parents on the other side of a flu decision like that. And again, our job is not to bully people into making a choice that they don't want to make, but we need them to understand that we have watched kids die from vaccine preventable diseases.
Yeah, I was gonna say all vaccine preventable diseases, not just flu.
We
All
have
of them.
watched kids die from whooping cough. We've watched kids die from flu,
Chickenpox.
from chickenpox.
Right.
So COVID is no different. And now that there is going to be a vaccine for this, well, most kids will be fine. There are some that won't. And it is our job, it is our calling, it is our mission to save every kid's life. And so if we can do that, that's what we want to do.
And I think another point, and Margaret should probably, because she does an excellent job with this. I mean, there's also all of sort of the trickle down, community society effects. And, the AAP, just an American Academy of Pediatrics last week, as announced, as many states did, that we are in a mental health crisis, state of emergency. And I mean, the very kids that we need to vaccinate are crying for help and suffering in so many ways. And the only way, the vaccine is the way to, there's educational deficits. All of this is compounded, in underprivileged and minority communities. The education gap is widened. I mean, all of these things that will directly affect our society and community locally and globally. The vaccine is the way. The vaccine for all is the way to help that. I mean, we're dealing with that too. We're dealing with in fact, in our office, we don't see COVID that often, but we see multiple consults for anxiety and behavior every day.
Yeah, sort of the COVID
we don't
side
see
effects.
COVID every day. We
right.
see
The social COVID side
our
effects.
emergency rooms are full. The pediatric emergency room is full of that also. So I mean, it's very real, and that's one of our biggest pleas to parents is to, protect your kids in other ways too, by getting that you're incidentally protecting your kid in another way too.
So as I want to make sure that we go over a couple sort of logistical details. So as this new vaccine is about to be approved, and this is going to be coming available to parents for their 5 to 11-year-olds, what is the best way that they can get vaccinated? Are there going to be mass vaccination sites? Are there going to be drive-through clinics? Do you need to call your pediatrician yesterday to sign up? What do you feel like what would you tell your patients how they can sign up and get vaccinated as fast as possible? Dr. Turner, let's start with you.
So I think the plan is probably going to be that the health department is going to give primary care pediatricians the bulk of the vaccine. And that's really, you should reach out to your pediatrician. We have sort of been piloting drive-through clinics with our flu clinics for the last 2 years, and that works beautifully. And that is a great way to get kids vaccinated. I don't anticipate there will be drive-through mass clinics like they did for adults, just simply because of the numbers. And quite frankly, kids, you really need pediatric specific nurses to take care of kids. I mean, it is an art form, and our nurses are spectacular at giving vaccines to kids. In fact, I often joke the kids would not want me giving their vaccines because I am terrible at it. Thank goodness for our nurses, who are amazing. So I think the vaccine will be available at pharmacies. I think some schools will either partner with pharmacies or may have access to vaccine, through the health department. I think a lot of that's going to remain to be seen. I've certainly seen, in online mom groups, people signing up for appointments, but we believe strongly in don't actually make an appointment for a kid until you have vaccine in office. And since it hasn't been approved yet, and we don't have any in the office. So actually, Dr. Evers, I don't know if you have any line on when we might be getting it in the office, but
not until that CDC,
which should be any minute, any day. We're sort of on waiting. I do have a quick question from a listener. So we have a question that says, she would like to know what studies have been done on kids who have already had COVID and whether they should get the vaccine. She says, hasn't it been shown that antibodies in COVID recovered people are far greater than the antibodies from the vaccine? So what would you recommend to parents where their kids have already had COVID? should they come and get vaccinated?
I mean, the short answer is yes. And that's, based right now on adult studies. I don't know the specifics of the study Pfizer did, if they, stratified data by, they knew beforehand who had it or not. But certainly in adults, we know adults can get reinfected. And the recommendation is for everybody to get a vaccine regardless of your, infectious status or not. So the thing we also don't know about, you have antibodies, but no one really knows what the protective level is. So even if you had antibodies, it doesn't mean, if you have like 5 or 10 or 15, like, there are differences. So, the recommendation will be there's no harm in getting the vaccine if you've had COVID before, is the other way to look at it. So the recommendation definitely will be to get it. Again, there's a lot of specifics we don't know about how long natural immunity lasts. We don't actually know that about how long the vaccine protection lasts. Like it may be some sort of booster at some point in time, but we'll be following that. So I don't know, not a great answer, but we know there's no harm from getting it. And so the recommendation will certainly be that you should get it regardless, because you just don't know.
Right. Get the vaccine.
Yeah.
So with that, get the vaccine, we're really excited for the 5 to 11-year-olds, but now we still have a group of kids who are younger and we're waiting. What does the future look like for those little ones? What's your best guess on sort of the timeline for that? Are they testing? And what are you telling parents? Are you saying hold tight, stay strong? Or are you saying, based on some of the mental health stuff that you're seeing with older kids, with younger kids, are you just like, well, make the best decision for your family in terms of how you're socializing safely? Like, what recommendations are you giving to parents who are sort of at their wits' end?
So we probably have the same information that everybody else does from the media, but it looks like it'll probably be early next year. There are studies ongoing in 6 months to 5-year-olds. It'll probably be a few more months. I mean, early I don't know, something in that range is what we're kind of hearing, again, for all the same reasons. You want to have enough kids, reach statistical significance, that's just, it's even less frequent in that age group. So it does take a while to collect that data. I think you have to remember, if you're at your wit's end, like the more people that are vaccinated, you're protecting your kid too, your younger child also. So, unfortunately, I think, kids are still wearing masks in daycare and things like that, but they're currently going to daycare. I think, the safety measures of masks in indoor enclosed spaces, if you're unvaccinated, just is gonna, kind of hold for kids for a little while longer. But the more people that are vaccinated in every age group, you're lessening the circulation of the virus, and thereby you're protecting those who cannot get vaccinated. So, I think older people too, whoever it is, you're also doing that. So, yeah, parents can hold tight, but getting yourself and your child vaccinated is only gonna help.
Last question really quick is about flu. So here we are moving into another new flu season, and we're trying to figure out COVID still. What are you telling people about flu? Can they get their COVID shot and their flu shot at the same time if they haven't already done that? So sort of a one-stop shop, get all the shots at the same time. That's good to know. Anything else that you want to tell people about flu vaccine this year, Dr. Turner? Dr. Edwards?
Don't skip it.
Okay.
There's a lot of people who feel like, since we didn't have a flu season last year, like, do I really need it this year? The theory, especially since we had such an early RSV year, is that flu is going to be right on its heels. And the theory is it's going to be a relatively rough flu year. And since no one has natural immunity from last year, that everyone's going to get hit pretty hard. So this, of all years, is the year to get your flu shot, get it early. We always say flu before boo, so you've got 2 more days to get your flu shot. But never wait, never hesitate. Get it as soon as you think about it, as soon as you get a chance, and get it anywhere. People have them everywhere. So go out and get your flu shot. So.
Well, thank you. A huge thank you to both Dr. Edwards and Dr. Turner for joining us today, both of Annapolis Pediatrics. I know that you're really busy right now, so thank you for taking time to speak to us and answer as many questions as we could get to. Thank you also to all of our viewers and listeners. Make sure that you visit ChesapeakeFamily.com for local, up-to-date information on home health and living for today's Maryland parent. This episode will be archived on ChesapeakeFamily.com in both video and podcast format. I'm Janet Jefferson with Third Floor Views and Chesapeake Family Life. Thank you so much.